Good morning. Good morning, everyone. My name is Julie Wong. I am the Education Manager at the Alzheimer's Society of Toronto. I wanted to introduce a collaborator of mine. Maria Martinez is from the Memory Clinic at University Health Network, and we have partnered together to do some caregiver education every few months on different topics. So I would love to introduce our speaker today. Our speaker today is Shrid Dungal, a very familiar friend of mine, and he is the regional lead for community engagement for the Central Ontario region, including the GTA at the Ontario Caregiver Organization. He has over 7 years experience in Canada in stakeholder and community engagement, as well as co-design work. He holds a master's in public health and has worked in global health initiatives in developing countries as well prior to him coming to Canada. So I am going to leave this time for Shrid. I do want to let you know that we are recording this webinar and it will be available on the Alzheimer's Society of Toronto's YouTube channel under our UHN and AST collaboration. So all of the topics that we have are all housed there within a playlist. So without further ado, Shrid, it's all yours.
Thank you so much, Julie. And Maria, thank you for inviting me today. And thank you everyone for allowing me to take some time off of your day. I'm going to start sharing my screen. Hopefully, Julie, just give me a heads up if you can see that. Awesome, so you can see the slides, right? Perfect. So like Julie mentioned, my name is Shrid. I'm coming to you from the Ontario Caregiver Organization, or we refer to ourselves as OCO. My role as regional lead is more working with on the ground with community partners such as the Alzheimer's Society, UHN, as well as with caregivers to kind of spread the word around caregiver resources that might be available, and also identify gaps in service and needs in service based on where people are interacting with me from, and kind of pass it up the chain so that our funders and the Ministry of Health know of the needs of caregivers across the province. So I'm going to start by talking about who we are. So the Ontario Caregiver Organization, we are a relatively new organization. We've been around for about 4 years. We were established in the spring of 2018. Back in 2016, 17, there were multiple projects that were ongoing where I think Julie, the Alzheimer's Society, was also a part of, that looked at access to care for isolated caregivers in the province of Ontario. And unanimously, all of these reports came back saying that, yes, isolated caregivers didn't feel like they had access to care, but caregivers in general felt that there needed to be a space where they could go to access information around being a caregiver and understanding what the caregiver journey might look like. So the Ministry of Health at that time commissioned a report, and by a person named Janet Bede, who happens to be our first chair board, who said that there needed to be an entity in place to look at caregiver well-being and help caregivers with system navigation across the province. So we were established, the OCO was established, and we are one of 4 organizations across Canada. BC has one, Alberta has one, Nova Scotia has one, and Ontario has one. So these are 4 provinces that have caregiver, an organization dedicated towards caregiver well-being. So we are completely funded by the Ministry of Health and are accountable to the Ministry of Health as well. So let's start by defining who are Ontario's caregivers. So we define family caregivers as any family member, friend, or neighbor who's providing care for someone else in an unpaid capacity. And that care could be due to any of the reasons that's written on the screen there. So we work with caregivers regardless of where they are in the province, regardless of what the diagnosis may be, and regardless of what their age might be as well. Now, we know that there are a lot of professional caregivers who are also family caregivers in their own time. And so we actually also have resources for professional caregivers on how to support family caregivers. And I'll talk a little bit about that as we go down the presentation as well. So when looking at caregivers across the province, we know that there are about 4 million individuals who identify as caregivers in Ontario. A large percentage of them say that they're between the age of 36 and 65, who also identify as being part of the sandwiched generation. That means that they're taking care of someone who is older to them, as well as have responsibilities towards someone who may be younger to them as well. The number of folks who identify as older adults, we have about 12% of the population who are 65 plus, but we've slowly started seeing a trend where the number of individuals who are older adults who are caregivers is slowly increasing. As we see folks who are living longer, we see that spouses and partners are taking on the responsibilities of caregiving towards their spouse, partner, neighbor, whoever that might be as well. And then we also know that a vast majority of caregivers, about 70% of caregivers, are employed, and especially during the pandemic, have reported that they find it difficult managing caregiving as well as their work responsibilities. So in light of that, we have developed resources that can help family caregivers who are working either full-time or part-time with some tools that will be able to help them balance that work as well. And I'll talk about that as we go down through the presentation as well. So who are the caregivers taking care of? So most of caregivers are taking care of one person, but about 1 in 5 are taking care of more than one person. So this could be either the person who falls within the sandwich generation, or it could be someone who is acting as a secondary caregiver. So what does a secondary caregiver mean? So primary caregiver is someone who is taking care of a care recipient, but a secondary caregiver is someone who is also helping the caregiver, who is taking care of the caregiver as well, right? So for example, if there's a father, mother, and daughter, then the mother might be the caregiver to the father, and while the daughter is helping the mother take care of the father. So she's actually assisting the caregiver. So that person could be identified as the secondary caregiver as well. When we're looking at their responsibilities, about 50% of caregivers say that their top responsibility is to provide emotional support to the care recipients. So other responsibilities include behavioral support, so as a result of maybe responsive behaviors, physical support, such as lifting and moving, administering basic medical tasks, such as giving medications, while also doing some complex medical tasks, such as giving injections and changing G-tubes, and also performing some personal care, such as bathing, toileting, etc. And we know that during the pandemic, all of these responsibilities have increased tenfold for a lot of caregivers, right? So caregiving does have really major impact on a caregiver's life, whether it be their time, affects their employment and their work-life balance, affects their finances. That's one thing that we know that caregivers have been talking about a lot, especially during the pandemic. It has affected their own mental health and wellness and their well-being, and has changed the relationship, personal relationships between the caregiver and the care recipient as well. While before the pandemic, we heard a lot of caregivers saying that they identify as spouse, partner, neighbor, friend to the care recipient, but because caregiving responsibilities have increased in the pandemic, a lot of them have said that now I really feel more like a personal support worker or a nurse, because all of the work and the responsibilities that are entailed as part of the caregiving definition have slowly changed during the pandemic. So how has that really changed? We know that caregivers in general say that they have extreme high burnout levels. So 58% of caregivers say that they feel burnt out. A large percentage of them have said that they are tired, 76%, and they feel trapped and overwhelmed. Caregivers also unanimously said that the one aspect of their lives that have changed during the pandemic is a lack of sleep. A lot of them have reported disturbed sleep patterns and also increased financial burden as a result of having to take on extra caregiving responsibilities during the pandemic. So what is it that we do at OCO, and how do we help try and meet those gaps? So first and foremost, we work with caregivers and with a general population to kind of improve the awareness and recognition of the contribution and importance of caregivers. We try and improve the awareness of the value that caregivers bring to the healthcare system and to the lives of the persons that they're taking care of. When we're looking at an economic standpoint, we know that on a yearly basis, caregivers contribute to about 26 to 76 billion dollars a year towards the Canadian mental health system. So that is a huge amount of money, right? So, and all of that is on an unpaid capacity. So that means that if we had to pay someone to do it, that much would be the cost of care to take care of the folks that caregivers are taking care of. Second, we try our very best to connect caregivers to information and supports by partnering with different agencies across the province. We want to avoid duplication of services. We understand that we might not be subject matter experts, and they are subject matter experts. So we want to be able to partner with those subject matter experts so that if a caregiver does reach out to us, we are able to connect them with some in-house services that we have, while also connecting them with the experts in the field and on-the-ground services based on where they're calling from. Another feedback that we get from caregivers is nice to get services online, but we really want to be able to speak to someone face to face and to really understand our situation and see how we can create a care plan, for instance, right? So we really want to be able to connect them with on-the-ground services as well. And then we also work with caregivers to identify gaps in service needs. So we have multiple opportunities, which I'll also talk about later as we go down the presentation, and so that we understand caregiver needs and we help build programs according to those needs, response to those needs as well. So I'm not sure if I share sound. Julie, if you can let me know if you can hear. No, okay. I'm going to stop share and reshare with sound. My apologies. Okay, I'm going to reshare with sound. I forgot to click that, check that box. Okay, let me know.
So I became a caregiver in my early mid-teens when my sister experienced an accident and she broke her foot. But she was misdiagnosed for a number of years, and through the repeated trauma, she developed complex regional pain syndrome, which is a rare debilitating nerve disorder. Because she had a rare disease, nobody knew about it and nobody knew what was going on. And it took a lot of trial and error to figure out how to best support her in there. My role within my family was a lot of emotional support. I offered a lot of navigating, so managing her pain, so through preparing her medications and almost crisis control every day. We're lucky now to have found almost a support group of people with the same disease and same symptoms, and finding your network of social support is fundamental in your own well-being as well. Somebody who understands your experience, that has been one of the most defining things in my journey, as well as finding a purpose and spinning negative experiences that you may have as a caregiver and finding a way to create positives out of it. The Ontario Caregiver organization has been a great help because it's given me a voice. I pushed for supports for young caregivers through the Ontario Caregiver organization and through the Change Foundation, and has given me a role in supporting the future generations and future caregivers. And that has been a newfound kind of passion of mine, and that is a positive that came out of caregiving that wouldn't have happened otherwise. When you have hope and when you have a sense of purpose and you have love, it's a whole lot easier to manage everything that's going around.
Awesome. So Michaela shared her story about her experience as a caregiver, and she was actually very instrumental in helping us establish our young caregiver program, which I'll talk about a little bit as we go down as well. So you saw that she mentioned a couple of strategies that had really helped her throughout her caregiver journey. So we learn from different caregivers similar to Michaela, and we try and establish programs based on ideas that caregivers like Michaela have on how it might help them through their caregiver journey. So, oh, sorry. So a great starting point is our I Am a Caregiver toolkit. So this toolkit is can be used for either a new or a seasoned caregiver, and it really helps them go through key information that can help them in their role as a caregiver, and how to develop a support team, for example, or how to understand their own needs and how to access supports based on their needs in order to avoid burnout. So the toolkit has a worksheet that can really help you look at the different responsibilities as a caregiver and really help you build a support team based on those responsibilities. You know, there are situations and instances where someone might reach out to you and say, hey, let me know if I can help in any way. And, you know, if there, it generally goes back of mind for a lot of caregivers. So if there's a space where you can say, hey, you know what, there is this worksheet, let's sit down together and see how you can help me. It really helps caregivers plan ahead of time as well. And then there's also a self-assessment tool to really see how they're coping throughout their caregiving journey emotionally. And the self-assessment tool is not meant to be done just once, but as responsibilities change throughout the caregiving journey, the self-assessment tool really helps guide how they're feeling emotionally, and then directs them to care or resources based on those needs as well. So feel free to check out this toolkit at your own time. I should mention everything we have, all of our resources are free of charge. We don't have any cost to any of our services. Next, we also have a working caregiver toolkit. So this was created during the pandemic. We know that many caregivers are trying to balance their work and caregiving roles, and this has proved especially challenging during the pandemic. So OCO has worked with and partnered with the Mental Health Works through the Canadian Mental Health Association to create this resource for employers so that they can better understand the needs of caregivers in the workplace. So the toolkit outlines 5 key steps for making it work at work, and helps caregivers explore ways to gain more support from their employers. So it helps, number one, learn about options that might be available to caregivers. It helps assess options that could work. It gives tips on having discussions with your employer and how to start the conversation around what your caregiving responsibilities look like. And then it advises on implementation strategies that could work at the workplaces, and then after a certain amount of time, helps you review and reassess if those changes that were implemented have made a difference in your caregiving responsibilities, as well as made you more productive at work as well. On the flip side, we have toolkits for senior leadership, for HR, and for management on how to proactively take steps and look at policy level work in order to make sure that their workplace is more conducive and more caregiver friendly. So you can find the toolkit on the link there. Please feel free to check it out as well. We have a lot of ways that we try and disseminate information to caregivers across the province. Our website, ontariocaregiver.ca, is one way. We have tons of resources available as well. The Young Caregiver Connect is our sister site, which is for young caregivers, which I'll also talk about later. We have a monthly e-newsletter for caregivers, which shares a lot of new strategies around things that you can do around mental health and wellness, and how to better navigate the healthcare system and access care. We have a quarterly e-bulletin for care providers, which has resources around things that care providers can use to better work with caregivers. And then we have our various social media platforms as well, where we're continually sharing success stories and also different ways that caregivers have been able to go through their caregiving journey. So feel free to check those out as well. One of the key questions we always continually keep getting asked from caregivers is around what kind of financial supports that might be available for caregivers. So if you go onto the link there, that it directs you to the financial support page on our website, which has tons of different resources available that you can go and check out, where you might be able to access financial supports for based on your current situation or your need as well. Additionally, we have other tip sheets. We have a COVID-19 resource center, which answers questions for caregivers around their experiences with COVID-19. We have web pages for specific populations, such as Indigenous caregivers, LGBTQ2S plus populations, as well as BIPOC populations, and a whole range of other resources as well. For a lot of caregivers, we also heard that they didn't have time to, for example, log into a webinar, or they continually kept missing out on webinars, or they were sick of looking at content online because there was so much and they just didn't know how to filter through all that information. So we started a podcast for caregivers that they can download in their own time. It's hosted by Michelle Jobin, and we have 2 seasons now that's available through Spotify, Google Podcast, Apple Podcast, and all the other major podcast providers. And it's a podcast that is run by caregivers themselves, and they invite subject matter experts to have discussions on everyday topics that might be relevant to the caregiver, such as what it means to be a caregiver, how do you manage money, how do you keep relationships strong, what does it mean to get a good night's sleep, and how can you facilitate that. Season 2 recently launched with topics such as navigating the healthcare system, caring for someone with an addictions challenge, caregiver mental health, and cultural differences in caregiving. So again, feel free to download these at your time, and you can listen to it whenever you can as well. And then prior to the pandemic, when we were first established, we were commissioned more to be that agency that helped other smaller agencies that had caregiver programming and try and help them build and scale their programs. But of course, the pandemic happened, who knew? And we responded to some of the feedback from caregivers saying that they really wanted more hands-on programming at OCO. So first and foremost, we started our webinars. So we have our own set of webinars that we do on a, I think, bi-monthly basis, so twice a month. On various topics. So we invite subject matter experts based on need, based on questions that we get from the community. And we have webinars throughout the year. We've had topics such as transforming guilt and resentment, caregiving, conflict, and compassionate communication. We had one recently on the 8 A's of dementia. We had one around addictions challenging for caregivers and how to work with the system, caregiving for adoptive parents. So a whole range of different topics as well. So for folks who want to go and check out our webinars page, it's linked on the page there. And of course, I'll be sure to provide this slide deck to Julie after. Julie, if you can send it out to everyone, then they can have access to all of these resources as well. Next, we also, based on earlier feedback around, a space where caregivers can kind of find where they can access information and supports, we started our Ontario Caregiver Helpline. So the helpline is a 24/7 helpline that helps caregivers find services relevant to their needs based on where they're calling from. As well as also connect with other services that might be available specific to their situation as well. The helpline is available 24/7. It's in partnership with 211 Ontario. We've trained staff at 211 to be community resource specialists and basically respond to caregiver-based inquiries. And based on those inquiries, direct them to either in-house services that we offer, but also other relevant services based on what their current situation is, and on the ground supports as well. The #1 call that we get from in the helpline is around respite needs for caregivers. So if you're looking for services for yourself or services for the person you're caring for, feel free to call the helpline. Again, it's everything we do is available in English and French. but the helpline is available in 150 different languages. Interpretation services is available in 150 different languages through the helpline as well. And for folks who are not able to call for whatever reason, we have a live chat option that is available on our website, 7 a.m. to 9 p.m. on weekdays as well. So any of our services that I talk about moving forward, if you want to access them, the best way to access them is by calling the helpline. So you can have that number on the fridge, and it might help you find out more. Next, we have the SCALE program. So the SCALE program stands for Support for Caregiver Awareness, Learning, and Empowerment. So this is a program that helps caregivers kind of think about their own mental health needs and build resilience. So it's 8 weekly psychoeducational webinars that is facilitated by a registered social worker or a registered nurse. And once someone signs up for the webinars, they receive pre-webinar materials. And after the discussions in the webinars, they're able to sign up for either individual counseling session or group counseling session based on a screening process that's done by the facilitator as well. What's unique about this program is that caregivers are free to sign up for either all 8 webinars or the one webinar that they really want to focus on. You don't have to sign up for all 8 as well. We run this on a semi-annual basis, so twice a year, live twice a year. But the most recent iteration of the SCALE program is recorded and is available on our YouTube channel as well throughout the year. Of course, the recorded versions, you do not have access to the individual or the group counseling sessions. That's only for the live sessions. And I believe our next cycle runs in September, at the end of September. So if you continue to check our website, you'll be able to sign up for them as it becomes available. I mentioned our Young Caregivers program. So we had a lot of discussion with young caregivers who said that they were not really resonating with the conversations that were happening in generic groups. So they wanted to create something for young caregivers specifically. So we created the Young Caregiver Connect.ca. It's a sister site that we run on an operational basis, but the whole website is the content is driven by young caregivers themselves, and the forums are all driven by young caregivers themselves. So it's a safe space for young caregivers to come together and connect and discuss their caregiving journey and be able to find support based on what they're going through as well. So it's anonymous. The discussion is anonymous to us, so that it's a safe space for young caregivers as well. We define young caregivers as caregivers between the age of 15 and 25. However, it's not really, there's not really a hard stop at 25 or a hard beginning at 15. We look at it at a case-by-case basis as well. So if you know of any young caregivers, please feel free to direct them to this website as well. And then we have new e-learning opportunities for caregivers. Our most popular course is the Caregiver 101 course. So the I Am a Caregiver starter kit that I discussed earlier on is built into this course. It talks about what caregiving looks like, what to expect, what conflicts might arise, and how to develop resiliency and what supports might be available for the caregiver. We also have a course that's called Caregivers Partnering with Healthcare Professionals. So this course is for caregivers to understand how care providers work, and also understand how they can start the conversation with care providers in making sure that care providers include them as part of the care team. We recognize that caregivers have an insight into the lives of care recipients, and they might be able to offer information to care providers beyond a particular, for example, ER visit. So we want caregivers to be included in decision making, and this course really helps caregivers understand how they can discuss and how they can start the conversation with care providers. And then we have other courses also that are upcoming. So you can access all of these courses through the e-learning website. You have to create a username and password, and then you'll be able to access these for free as well. So During the pandemic, we also got a lot of requests from caregivers to start some peer support groups. So these peer support groups were created as an offset to other supports that were either closed or there were restrictions during the pandemic. And this is a space for caregivers to come together and just have more generic conversations around what they're going through. Because we are a non-disease specific agency, these support groups are more generic in nature, right? So, and our main aim for these support groups are more system navigation and emotional support. Once someone does join the peer support group, which as the name suggests is run by peers, by caregivers, experienced caregivers themselves, the main aim of the support group is to be able to connect the caregiver who is in need with more appropriate services. So if they're really looking for more hands-on information around what's going on with the care recipient who has Alzheimer's disease, for example, then we would connect them with the Alzheimer's Society based on where they're calling from. So you can register to participate in the support groups through the webpage on this slide as well. And then for a more of a personal touch, we have a one-to-one peer support program. So we have experienced caregivers who sign up to be peer mentors through OCO. They go through peer mentorship training through OCO on how to be a peer mentor. And then based on requests that come in from caregivers who are looking for that more one-to-one support, emotional support, we match experienced peer caregivers who are peer mentors with caregiver participants. We ask the relationships last for up to a year so that they can build some rapport. And on the face of it, this program is billed as a telephone-based program. But after we've introduced the caregiver and the peer mentor, we really leave it to the two of them to define how they want to proceed with that relationship. If they want to meet on a virtual platform like this, or based on public health guidelines, if they want to meet at a local coffee shop, we really leave it to the peer mentor and the caregiver to define those terms based on their own comfort levels as well. So the top end goal for this program, the one-to-one peer support program, is to be able to offer emotional support based on what caregivers are going through on a situational basis as well. If you go to the website that's linked on the page, you can sign up to be either a peer mentor or a caregiver participant through that link directly. So we, in addition to providing direct supports to and services to caregivers, we also engage care providers, organizations, and system leaders across many sectors. So we, our team collaborates with provincial, regional, and community-based stakeholders. So, for example, we work with the Ontario health teams to kind of embed caregivers and caregiver needs within Ontario health team plans. We work with care providers to offer them e-learning as well as tools and resources that might be so that they might be better able to work with caregivers that they're seeing in their own practice as well. For example, in primary care. So care providers can make a meaningful difference to the caregiving experience and the quality of healthcare. So our work with care provider centers on three really important strategies. Number one, recognizing and including caregivers as true partners in the care recipient's care. Number two, the role of providers in connecting caregivers to support for their own mental health and well-being. And number three, meaningful engagement and co-design with the caregiver. So our caregiver, we have e-learning services for care providers as well that enables care providers with know-how on how to communicate better with caregivers and really recognize caregivers as essential partners in care. So these are also available free of cost for care providers. The Caregivers as Partners actually is an accredited course and has MainPro credits that go along with it for professionals as well. We also have a care provider resource center where we offer different tools for care providers on how to meaningfully engage with caregivers in co-design, recognizing that caregivers are essential when it comes to, for example, filling out either a medical or a social prescription, right? So really working with caregivers on a care plan. One example of how we've made that happen is our Partners in Care Pandemic Toolkit, which was developed during the pandemic, where there was a lot of caregivers who said that they were not able to readily visit or access care recipients either in long-term care settings or in hospital settings. So we partnered with many hospitals and long-term care providers to establish the caregiver ID, for example, where the caregiver would receive an ID badge that said that I am a caregiver, rather than say that it's that they are a visitor, so that visiting hours wouldn't apply to the caregiver. And then there are other tools also in this toolkit where the institution, the hospital, or the long-term care center can take the pledge, the Partners in Care pledge, and also have signage that can help caregivers really move more easily within either a hospital setting or a long-term care setting. We are in the process of creating a similar toolkit for community-based settings at this time. So that's something that's in the works. So if you'd like to know more, please feel free to go to that link and it'll take you to the Partners in Care Pandemic Toolkit as well. Another toolkit that caregivers and care providers can find is the Time to Talk toolkit. So many caregivers have told us that there are simple things that healthcare providers and service providers can do to make a difference in their lives. And asking a simple question such as, how are you, can really start a really important conversation around caregiver mental health and well-being. So this toolkit has a lot of tips on how to start that conversation. So it's geared for healthcare providers. For example, the tip sheet around 7 simple ways to recognize caregivers, to engage with caregivers and support caregivers is a really great way for healthcare providers to engage and make sure that caregivers are being supported and are recognized that they might also need help throughout their caregiving journey. So feel free to check out this toolkit as well. And then we know that Ontario's privacy and consent laws are really complex and can be a barrier for effective communication between a care provider and a caregiver. So we've developed tools to really help the caregiver understand legislation in very easy language, so that you can really bring up conversations and have more meaningful conversations around privacy and consent, around, for example, what it means to have a power of attorney, what does a substitute decision maker mean? So all of these different topics, you can find these on our privacy and consent resources available on our website as well. And then I mentioned earlier, there are multiple opportunities for caregivers to offer insights and engage with us as well as within the system level as well. So we work, for example, we have our advisory committee, we have different working groups, we have a mental health working group, we have a young caregiver working group, and then we also work with, for example, Ontario Health teams and their PFAC teams, which is the Patient and Family Advisory Table teams, to make sure that caregiver input and caregiver voices are being heard at a policy and a decision-making level as well. And then we also have one-off opportunities throughout the year where there might be different call-outs based on what the government is doing, and we offer those opportunities such as focus groups to caregivers to participate on an ongoing basis. Like, for example, recently we had one around caregivers providing input around what they saw during the pandemic at long-term care. So the government was looking at revising the service standards in long-term care settings. So caregivers were able to provide input based on their experiences throughout the pandemic as well. We recently launched our Caregiver Voices platform. So this is an online platform for caregivers to share their lived experiences either in English and French, and to help inform the work at OCO and also influence the work at a system level as well. So there are multiple opportunities that are ongoing, and there are multiple resources that are in development at OCO. And when we do develop those resources, we want to make sure that caregivers are able to provide feedback on those resources and really make sure that those resources are meaningful to the caregiver. So the Caregiver Voices platform, once somebody does sign up for in this platform, it's free to sign up. Then they are through email notified on the different opportunities to provide feedback, and based on their interests, based on caregiver interests, they can sign up to participate in any of the different opportunities that arise through this platform as well. So if you are a caregiver, if you know a caregiver who wants to provide input and is looking for a space to do so, then please feel free to direct them to the Caregiver Voices platform. And then similarly, we do a lot of public awareness campaigns. Again, our number one priority is to increase the awareness of caregivers, the value that caregivers bring in the community. And so we work with different media channels and different social media platforms to make sure that those stories and caregiver voices are being heard as well. And then we also have different resources that are public facing that are available to the community in general to interact and engage with caregivers and make sure that caregivers are being seen as well. So you can go onto our website to find out more on this as well. So that is our presentation. You can go onto the ontariocaregiver.ca/subscribe page to subscribe for our newsletter. And if you have any questions after the fact, if you don't have them now, feel free to reach out to me. I am the region lead for Central Ontario, and I'll be more than happy to answer any questions you may have at a later date as well. Right, over to you, Julie.